So I want to thank the first panel on the tribal leaders this morning about their perspectives and their concerns regarding this issue. So good morning, Yat Ehepina. I'm Agnes Attakai. She'e na kaiden enishla. I am of the Navajo Mexican clan. Twitzoni Bash's chain, born for the Big Water clan. Kachitni Dashache, so I am of my mother's side is the Tobacco clan, descendant from the Hopi Tobacco clan, and I'm also Big Water. So that's who I am. I grew up in a small community called Tisto, Arizona. My family is actually part of, oh my gosh, impacted by a lot of federal policy. So starting with the boarding schools, and so I myself have been to boarding school. My parents have been to boarding school, so has most of my family members. We're part of the urban relocation program, so my parents were relocated to Glendale and Burbank, California after they finished at the Sherman Institute. And we're also part of the massive relocation of the Navajos and Hopis as well. So our family has experienced a lot of trauma. And we all know too well in our family about the sober living crisis and the issues that happen when people are trying to search for help and yet are I have no other words to describe other than being kidnapped and imprisoned against their will. So with that said, our panel is going to focus again on the sober living home crisis. And our hope is to increase among you all the pressing, knowledge about the pressing issue of fraud and abuse in substance abuse treatment system in Arizona, and emphasizing the challenges faced by indigenous populations and how they have been targeted by exploitive practices. And also really for you to think about partnerships between different agencies to help address this issue and to develop sustainable solutions. And also for you to really think about how you can also take action to address this issue, whether it's within your own family, in your community, as a student, as a researcher, as a policymaker, or a community advocate. So I've introduced myself. I'm Agnes Attakai. I come from the University of Arizona, one of the 3 state universities here in this wonderful state of ours. And I just told you what the objectives are. So what we're going to do is we're going to start with our organizations here. We have our panelists, and each of them will introduce themselves and also address what their agency is doing to address this particular issue. So we'll start with Matt, and then we'll go with Valaura, and then Jolyana. Okay, Matt?
Thank you. Hi, my name's Matt Meier. I'm a clinical associate professor in the Department of Psychology here at ASU. I'm the director of a relatively new master's in addiction psychology program, and then also the co-director of clinical training for the clinical psych PhD program here. I'm coming from a focus of kind of 2 different programs. One is a training grant that I have for psychology graduate students that focuses on learning to provide integrated health and addiction treatment through telehealth with a focus on Native Americans, for which Valaura is a consultant on that grant. And then I also provide supervision and training out of our clinical psychology training clinic, where we now have a new addiction practicum program for both in-person and telehealth services. And it's really through the work that we've done through our training clinic that we've been working with Native Americans who have been rescued from these predatory sober living houses.
Good morning, everybody. Thank you for having me. I just introduced myself in Hopi. My Hopi name is Hunwensi, which means standing bear woman. I am from the Cloud Clan, and I'm also from the village of Songobavi. My Hopi name is something that I often refer to in terms of the work that I do. As in our culture, the Bear Clan is our higher society, and I have a lot of duty and responsibility to the Bear Clan as well. My English name is Valaura Imus-Nahsonhoya, and I'm currently the Missing and Murdered Indigenous People coordinator with Governor Hobbs' office in our Tribal Relations Office.
Good morning. Can you hear me? Testing. Yat a abinet anoltwa she a trachini nishlinto tsana jini a dashaje bashichin. Ashche dashache ado ye idana etrachini dashanale. Jolyana Begay-Kroupa Yanishia. Good morning. I am Jolyana Begay-Kroupa, CEO with the Phoenix Indian Center. I'm an enrolled member with the Navajo Nation, come from the community of Fort Defiance, Window Rock area. I was born and raised there, and I moved here to the Valley to go to school at ASU. Yay! And I've been here since. The plan was to return home, but I stayed around here, and now I'm an urban mother, have 3 boys, and we maintain a living here. And I work for an amazing organization that dedicates its programs and services to urban American Indians that have either relocated here as part of Indian relocation, or they come here to go to school or to find employment. And so the center is a space where we organize programming based upon the needs of our community. We're the oldest Indian center in the country. We are in our 76th year. And so over time, we've become a trusted organization by our urban members and relatives that live here. And so I'm happy to be here and to share what I can about, what our organization is doing and or what we could do better moving forward. So I'll say that much for now. Good morning. Thank you.
So we have introductions of our panelists. So one of the questions that we have is that telling us a little bit about your programs and your role in our experience with the sober living crisis. And with the sober living home crisis, what services have been impacted because of this particular crisis. So let's start with Matt.
Thank you. So we've had no involvement in housing and solely provide outpatient services. Our focus recently has been working with people who have been pulled out of sober living houses, and so trying to provide legitimate actual treatment for those who want it. But the constant struggle has been what is the alternative to living. With all of the sober living houses being shut down, we have not been able to find alternatives. And so, for example, I have a client who is living in a house. It used to be a sober living house, now it's just a house, and she's still being able to stay there for free, as is her adult son. They're not receiving services. They are being asked to help work in a restaurant and not being paid for that. And so is this barter where they're exchanging some help in a restaurant for the ability to live there, or are they being taken advantage of? And we asked if they want us to help address this situation. The problem is there's not another place for them to go to. They were homeless and were able to get in and get into recovery, and so they're doing amazingly. And they're still getting some transportation services from that house to go to school. But I don't have an alternative for where to put them. And so I'm always nervous about what's going to happen to them. But this is kind of where we're at right now is there aren't good solutions. And so I think I'll talk a little bit later about what are alternatives to helping people back in their communities as opposed to living in the streets here and still trying to get into recovery.
going to back up a little bit here. So prior to coming to Governor Hobbs' office, where my consulting firm, Hunwensi Consulting, we have a missing person trafficking recovery program. Currently, as I'm in office, my husband Brandon manages the program. But even before this, since 2015, Super Bowl was happening, we are recovering trafficking survivors, indigenous survivors. During Super Bowl, this was our enlightenment in terms of the vulnerabilities in terms of our members that were being placed in these type of situations. It wasn't until I was also part of the state ad hoc study committee around MMIW, and we learned so much during that time. ASU Research on Violent Victimization was our research partner in those instances, and learning from our indigenous members and families of some of their experiences, not only around missing and murdered, but also trafficking. We also became interested in some of their experiences as to why they were being missing and are murdered, or why they were being trafficked, and it really led down to the substances. So my husband and I, we've been recovering members also out of sober living since 2020, I believe it was. And at this time, we did not know what this whole situation was about. We just knew that our indigenous families, members, needed help and to get out of these places. It took a while for us to understand what was happening. When we learned what was happening, my background is victim services. My profession is with law enforcement. So I referred all these cases to the law enforcement agencies, and working with our families and our survivors on their victimization, but also in their healing and their recovery. We had to seek our own services to be able to help navigate these members. And a lot of these members did not want service, which was very difficult for us to be able to place appropriately. And through our experiences, it's really not only enlightened us, but it also challenged us in terms of what services we could provide. With my experiences with ASU research, I've become so critical in terms of, utilizing these experiences and sharing these stories, because I'm very big at gaining and obtaining permission prior to sharing survivor stories. So, now with Governor Hobbs' office, my role, I believe, is really critical in this crisis, because I'm paying attention to those members who are missing and murdered in these sober living facilities. We talk about data and research, right? But we have to get a lot of permission, though, from our tribal communities, because we don't know the onset in terms of if this crime occurred from reservation to here, Phoenix, or to other urban areas. So we're very careful in terms of how we're addressing this issue. But for the most part, again, working with law enforcement and sharing some of these experiences and being that support to these members so that they can share their experiences to these law enforcement agencies. It's not only about judicial accountability, but for myself in being in victim services and helping our members who are not only addicted, but also going through traumatic experiences, is getting them on these healing paths in which the partnerships we created, such as with Matt's organization, to begin talking about these therapeutic opportunities for these members. So this is what I can share at this moment regarding our experiences.
So at the Phoenix Indian Center, I mentioned a human service agency that provides programming. We have workforce services. If people want to obtain employment, or maybe they had a gap in employment, they'll come to the center. We have youth development, college and career readiness programs that are set up for our high school youth. So we have some partnerships with the districts that have high Native population. We have language and culture component, so creating space for our relatives here to stay engaged in who they are as an Indigenous person. Language classes, storytelling events, and so on. So those are some of the programming, community-based, that we offer. And then we also have substance abuse prevention. In our substance abuse prevention programming, we have evidence-based curriculums that we implement in schools, at different community partner organizations. One of them is for junior high youth, and another one is for parents. And so that's kind of an overview of the services we do. But because of the history of the center and it being a trusted org, many times our customers, our clients hear about our organization by word of mouth if there is a need of some sort. It may not be a service we directly provide, but they'll still come to us. So one of the ways in which we started to see and witness some activity around this crisis was when there would be groups that would enter into the building. They usually had, a quote-unquote chaperone that's with them. In some instances, that person would do most of the talking on their behalf. But they would come to get their CIB or find out information on how they can obtain their certificate of Indian blood, and how can we expedite this process for them. So at the time, of course, we help. We don't issue them right there. We help them make connections to their enrollment depending on the tribe. And so we noticed that this was kind of a pattern that was occurring, and we didn't, and in some instances we tried to talk directly with the customer or the client, but they kind of were, there was always sort of somebody speaking on their behalf, and that's when we knew there's something interesting here, and what's going on. And then we noticed a lot of these facilities were wanting to leave their business cards or information about their programs at our center. Can you place this here? And a rise of them coming in was a little bit of a red flag. So there's something happening. Why do they all of a sudden want to leave all their business cards out? Some of the business cards were like on printed paper. There's not enough information. There's no website, or the website didn't work. So we stopped putting those out. I'm like, let's find out what's going on. And so that was really kind of one of the ways in which we started to experience the influx of customers coming in that were at these facilities. We don't do behavioral health services, but we are doing a lot of referral. For the chaperones, where's the Indian Medical Center and what do they offer? Are you Native Health? It says NAC on your address. So we were answering a lot of questions. And so that was when the center really did realize that there is a rise and there is obviously something that's occurring. And so what we started to do is we met with NAC, who is our sister agency, Native American Connections, and then Native Health. And they have because they do behavioral health services, so they had a triage form where they're writing as much information down. We mirrored some of the documentation, what we could, and started to keep track of who are these people coming in. And then we asked in the questionnaire, are you safe? Have you contacted your home? Have you, do your family know that you're here? In some instances, they're wanting to share, and in others, no, they're reluctant, or they're fine staying with, their chaperone, and didn't want to go, in some instances, if the client was under 18, then we did call the police, or if we felt there was something sketchy, unsafe, if they're intoxicated, we would call the police. But that's kind of our experience on the front end of how the Indian Center started to get involved and engage.
So with these three organizations here, from research to practice to preventive services, we've all been impacted by this issue of the sober living crisis and murder missing Indigenous people. All of it's really connected with vulnerable people trying to seek services, and how do we address that? So the question I have for the panelists is, what are some of the potential long-term consequences of trauma and homelessness on individuals affected by this type of exploitation? Matt, do you-
Well, I've stopped using the term historical trauma because it's just ongoing, right? This is just the latest iteration of exploitation of Native Americans from health services. And so when we first started working with people referred by Valaura, I was terrified about how we were going to make a connection and how could we even begin to start building a trusting therapeutic relationship. And I was surprised and very happy to find out that everyone that was coming in just wanted to help, right? They were seeking help, and we're going to keep seeking help until they got some. Unfortunately, there's a huge sampling bias here, right? The people that were willing to keep trying were the ones that continued to come in and see us, but I have no idea how many people were lost and just gave up on seeking treatment because of what they had experienced. And so those we've seen, they're doing the work, right? They want help. But how is it that we reach out to those that aren't going to continue to seek services? And so that's, I mean, we are building the airplane as we're trying to fly it. And so one of the things we've been working with is how can we do more outreach? How can we start talking to people about legitimate treatment services as soon as possible, so that we can try to get them when they're still willing to hopefully seek services, but that's tough, and so that's the goal right now is how do we do more outreach? How do we connect with people as early as possible?
This is probably a better question for my husband, Brandon. He's currently on the streets doing homelessness outreach, but I can share with you that, through our experiences, unfortunately, many of our members are becoming homeless that are in these sober living situations. We do have a response. One of the response is the state response by 211. Another is through tribal assistance and also our grassroots assistance. So there is an outlet, there is resources, but what I observe is that it's really up to the member and where they want to receive these services. Jolyana mentioned trust. A lot of trust has been broken. At least in my mind, as with my background in victim services, we want to empower them. We want to empower them to make a decision, to make a choice of who they're going to go to get the resources. We have to remember that, as Matt mentioned, our historical trauma. Part of the education that I do with not just members, but any person who has been victimized, is really to help them understand, that their experiences is being carried forward, and they're carrying so much on their shoulders, from their late grandparents to their grandparents to their mother, themselves. All of this trauma that we experience in their lives, in our lives. For example, now I'm passing this on to my daughter. All of our experiences of trauma is being passed on to my daughter. She's carrying all of our weight. We're still fortunate she don't have a child, and I'm doing my best to protect her. In terms of that she don't carry her own trauma onto her child. So with the substances added to our historical trauma, And again, I'm going to speak for members who have shared these stories and who have given me permission to share this story. We have many members who, when they come out of the sober living home, they don't want to go home. They don't want to go home because we live in multi-generational homes. We're very overcrowded in our homes. We're going back to the reservation where we have limited resources. Many of our tribes here in Arizona are not tribal casino revenue tribes. My tribe in particular, Hopi, our biggest revenue was Peabody. We don't have that anymore. So we're very limited, not only in that financial infrastructure, but also our programmatic infrastructures. We had to apply for federal grants to be able to service some of our programs. We have the limited accessibility of professions coming onto our reservations to provide these type of professional services. Because what's happening is that it's our peer support specialists who are providing these therapeutic services. They don't have the degrees, they don't have the experiences, they don't have the licenses, and this is who these members are going to. One of the things I always think about is our children who are affected by this issue. Our members become pregnant. Our children are being born addicted. That's another area that we haven't yet even discussed. What are we going to do with our victims, our children, who are going to grow up in this addiction or this experience? So, those are some of the long-term consequences I can think of in terms of trauma-related and the response to this crisis.
Yes, I would agree that it's almost as if there's an added layer to many of the challenges and the barriers that our community members face. And so that added layer is that added weight. We already have, as Valaura touched on, the historical intergenerational trauma that is there. And so even though we may not have a direct experience in our lives, but it's still there. And learning about what historical intergenerational trauma is, that awareness is an area of work for the Phoenix Indian Center. We try really hard to implement through our prevention programming what is historical intergenerational trauma. That understanding of it, creating that awareness, helps others to learn about. They may not be directly impacted right now, but in some way they are. Through our programming, like our Gathering of Native Americans, it's the acronym is GONA. We have community GONAs throughout the urban spaces, and with our neighboring tribes, Gila River, go out to Sackatone or District 6, Salt River, and implement our GONA activities. So that's one of the ways that we're trying, through the prevention programming. But in terms of the long-term consequences, many of our people are transient. So they go back to their original homelands on the reservation, and then they come back again to the city. And over the years, there is a rise in the number of Native families that are living in the major metropolitan areas like Phoenix. That number is just increasing. And so knowing that, the long-term consequences, we need to be ready for our community here. We need to remember that there are thousands of urban peoples that are here. I know sometimes as an advocate for the urban members, there's always a lot of conversation or dialogue happening with our members that are still on the nation, and I'm always trying to well, there's still a whole bunch here. They live here too, and in fact, the spaces like the Indian Center are becoming ever more important, especially now, because we know there are thousands that are living here and continue to move here, and so having some really strong lines of communication and support with the tribal nations and the urban spaces and those partners that are wanting to dedicate their work, I think is really an important step. But you know, that added layer truly is, I think it's really a sad reality for us as Native people, because we already have so many challenges, and now this. So it's like, oh, all right, let's get this load, and how are we gonna find a way to move through, continue to fight, and to find our way back to, in my language, we call it hojon. Hojon is translated in many different ways. It doesn't just mean beauty, but hojon is having balance. It's knowing who you are. It's utilizing your foundation to stay away from things that are harmful, like drugs and alcohol. How do we get our people back to that hojon state when we have another layer of added trauma? That's what we're here for. And I think the mindset of moving toward, we have to find a way to stick together and battle this together, is one way in which I try to remind myself as the leader of the Phoenix Indian Center.
Thank you very much for those comments. As for our panelists have mentioned that, you know, our most vulnerable people are now, you know, mistrustful of organizations and don't seek services and are facing so many challenges. So how do we as people, as organizations, or your organization, help to create that trust again so that folks can come in and receive services?
So I think there's a couple of ways forward that I've identified. One is that we need more mental health and addiction treatment providers who are Native American, right? And so recruiting people to get the training who are likely to go back to their communities to provide services, or locally in the metropolitan area. And so that's our Master's in Addiction Psychology is an online program, right? And so the hope is that we can not even have to require people to come into to Phoenix to get that training, but that we can recruit more providers from local communities. The second one is to also do a better job of getting services onto into Native communities through telehealth. Now, my experience with providing psychotherapy in general is group therapy is just as effective as individual therapy, but most people don't want to do group. They'd rather do individual. They don't want to deal with other people. And I've seen a similar experience with telehealth is most people don't want to do it. They'd rather do in person, even though it can be just as effective, right? And so how do we make a case for doing telehealth services so that we can provide additional services in rural Arizona? And so one of my goals with our with the addiction practicum out of our clinic that's affiliated with the Master's in Addiction Psychology is to provide both in-person and telehealth services, so that if we have people that are going back and forth, they can get services when they're here, they can get services when they go home, that they can, in trying to deal with the homelessness issues, rather than coming in here and not having a place to live, they can be at home and receive those services. So really, we want to expand that broadly available effective treatment and make it as available and easy to access as possible. We've pushed to get external funding to be able to provide these services for free. So with my HRSA training grant, the services we provide, that grant covers the student costs, the clinician and supervision costs, so that members aren't having to pay when they come in. Again, with the addiction practicum, I have external funding to build that, so we can provide those services for free. And it's just a matter of making those connections, making people aware, but also convincing them that this is an effective way of seeking treatment.
I guess my response to that is that I've been burned many times as well in my referrals. I have to really be intimate in terms of where I am also placing them, because I need to know where I'm placing them. I need to be in that building. I need to talk to the individual. I need their credentials. I need to know where are they coming from? How are they being billed? Who is their financial source? All these questions I ask. If they can't give it to me, I'll walk away and I won't refer. But it takes a lot. It takes a lot of work. It takes a lot of, for me, patience and time to be able to seek appropriate services. I feel very fortunate to partner with Matt and his organization to be able to refer our members to receive the free services, that they are actually talking about their addictions. They're talking with therapists. Many of them tell me, but they're students, you know, but they're in their graduate program. So I have to explain what that means, right? They may already have the practices as with their BSs, or they may be master's program, you know. So really having the opportunity to take the time to explain to them what this all means is, again, not only time consuming, but it's almost visualizing. I'm always mapping. I'm a visual person. We're very visual, Native American. We want to know exactly from point A to point Z, what are we doing, who are we going, what are we going, who are we going to be meeting? So these are some strategies that I've worked in terms of ensuring that they can also trust me and where I'm referring. But also, the second thing is that ensuring that those individuals, that program is also trained in terms of cultural competency. Learning who we are as Native American people, learning our historical experiences, learning about all our tribes. We have over 500 tribes. They're not gonna all learn all of them, right? But being able to give them the resource to learn about a particular tribe is very helpful with their clients that they serve. For example, if I'm coming to Matt, I want him to know who I am as Hopi. I want him to know, you know, where did we come from in terms of our own historical traumas as well. The little things, you know, Matt mentioned telehealth. Many of them don't want to do telehealth because they've never used a computer. Many of them want to use it because they don't have access to internet, or their data on their phones is so limited that they don't have the opportunities to be able to hold an hour session, right? So, you know, these are the challenges that we face, we will continue to face, but the in-person as well is very intimidating to our members. This population in particular are homeless, may not have the attire to go and walk into a business. It brings a lot of shame to them that they can't walk in an office clean. So they choose not to go in person, right? That we have to put aside. You know, they're not going to come to you clean all the time. They're not going to, they may still be smelling like alcohol, you know, but they're here for a reason, you know, and that's that cultural sensitivity that I talk about. And but not only that, but also their experiences, because I guarantee you 90% of them have some type of a victim trauma. And these are some things that we have to consider, be mindful of in terms of gaining that trust. If they come to you and say, I need help, give them that help. Build that trusting relationship. Even if it's a simple call or text, how are you? You know, I was just thinking about you. Those simple messages mean a lot to an individual who is experiencing not only this crisis, but any kind of trauma.
Yeah, that's good. So in terms of, so we don't do, you know, we're not a treatment center. We work in the capacity of making referrals as best we can. We stay close to those organizations that we trust and we've been partnering with. So we haven't had, you know, people, clients coming through the center has not decreased, right? So we're kind of from a different standpoint. But we do get asked quite a bit from entities that want to work with Native communities, why there is sort of this wall that's there. Like, I really want to work with this family, or I'm trying to help this community, but I'm not getting anywhere. How can I, you know, I want to support, what can I do? And so Valaura touched on the cultural awareness. We offer cultural awareness opportunities to learn about the dynamics that exist within many tribal communities. Again, not being tribe specific, but that understanding and awareness is helpful. I also give recommendation, you know, you have to give it time, so it's nothing against you personally. There's just this history that is there, and trying to get them to understand that, you know, this is why you're probably not connecting on your first visit or your second visit. And I also provide recommendation of be present in the community. We have, you know, our Native American Recognition Days, we have our powwows, we have all these different events that go on here. If your entity is present in the community, you're probably more likely to create trust a little bit faster with the communities that you want to work with. So those are some of the things that I wanted to offer around this one, but we haven't had, you know, that the trust is still there, but we're also not a treatment center, you know, that can provide the support and services.
Thank you very much. So one last question. Again, this is your opportunity to share with the audience here of what are some of the lessons learned that you can share from your experience from this crisis so that it doesn't happen again. So, yeah.
So I've been in the addiction treatment field and working in a number of states, and I was really surprised when I started learning about how sober living housing is done here in Arizona. I think there's two distinct differences between the model here versus how it's done in most other states, as well as the models that have been studied that have shown effectiveness of sober living houses. And those are where sober living houses fall in the stage of treatment, as well as how sober living houses are financially supported. So everywhere else I've worked, people are stepped down to sober living houses after they've done residential treatment, or after they've at least established a bit of sobriety or recovery, and are still involved in outpatient treatment services. But so there's already at least a little bit of stability there, right? They're actively engaged in recovery. Versus what I've seen here is sober living houses are many times the entry point into treatment. And it makes sense to address the housing or the homeless crisis to get them in so that they can have some stability to seek treatment. But sober living houses aren't set up to handle somebody that's actively using, that may need detox, that may be seeking housing services and not interested yet in getting into recovery. And so if we're going to proceed with this Arizona model, I think there's a lot of research to be done on how do we make this actually work, because putting a monitor that lives there without any training or minimal training is not going to be sufficient to protect residents or to help them get into recovery. And for the residents that do have a bit of recovery already, we're putting them at risk by continuing to bring in people that are actively using. The second aspect is how these homes are funded. Every other sober living house I've seen is funded through resident fees that you pay to live there, just like you'd pay rent anywhere else. Now, there's attempts to subsidize that through charitable donations or connections with other agencies, but you still are at a place in your recovery where you're able to get a job and pay a portion of that to live there. Okay, I don't understand. Well, and it's not really feasible for community mental health and addiction treatment agencies, at least the small ones, to be able to subsidize sober living houses, at least not legitimately, right? And so it was set up to be abused, I guess. The houses were being used to capture that treatment population that they could bill on, and so which resulted in the coercion or even forced stays there. So if we get to where this is a legitimate sober living house model, there's a lot of changes that I think need to be made. So I think that's an area that we have to figure out how to, at the very least, modify to make this an effective component of recovery. And then separately, one of the other aspects of research that I really see us needing is what was touched upon is the cultural aspects of treatment. I can bring people in and teach you evidence-based practices for addiction treatment. And some of that is generalizable across all populations, right? But there's also the unique cultural aspects, whether that's the intergenerational trauma and the betrayal of health systems, or it's the unique needs of how people have grown up, or their susceptibility to addiction, but also incorporating more of the traditional practices. We heard how important that is, and we really need to be looking at how do we incorporate that, and how do we make treatment specific for the individual, making sure that we have connections back to the communities. Like Valaura said, we can't have 22 unique treatment programs for the different tribes, but what we need to do is be able to connect our clients with representatives from their tribes that can bring in that cultural aspect, that we can bridge that treatment to community, and partner to make this as an effective approach as possible.
I think the two biggest things I learned in this situation, one is that with our members, we have two sets. The first is that they want to come to sober living to be sober, to learn how to be sober, right? The other set are those individuals who are following these activities to solve their homelessness, maybe. So the learning lessons, is that we have to grasp those individuals who are truly wanting to go into sobriety, right? Providing that services to them in their sobriety path, whether it's the therapeutic services, whether it's learning about their substances. We ask these questions on the streets. What do you know meth is made of? Many of them can't answer. I don't know meth. How do you smoke it? And they show us their pipes, right? So they don't know, like, the chemicals in meth is just there. They just use it. When it's the other set, they're following these activities in terms of, you know, I don't want to be sober, but I'm going to go somewhere that's going to give me the alcohol and drugs. And some of these sober living homes, that's what was happening. They were bringing in the alcohol and the drugs, utilizing it in these homes, whereas those individuals who are trying to be sober are in this same home, but they're also being victimized somehow, whether it's assaults. So we don't have, in my opinion, we really need to work hard at identifying what program is going to best fit these individuals. But also, I think about those members who truly are on sobriety, who honestly share their experiences when it comes to their victimization. Because those are the individuals, again, because of my victim service background, I want to be able to help through the process of reporting. I want to be able to help in terms of getting them some justice. As we know, though, these incidents are taking a long time to investigate. There's so many components in this situation that the investigation is taking a long time. You know, we've had an incident where a 2020 case was just adjudicated. And so it takes a long time, it takes years. As victims, we want something to happen now. They lose their patience. They're waiting for investigators to come give an update. They're waiting for prosecution to say, when is my hearing, right? But we have to keep on this path of being the support to them so that they continue and they're supporting their case through this justice. But I feel that still, you know, it takes all of us. It takes all of us to really not only be sensitive to the situation, but also be totally educated in terms of what's happening to these members from both perspectives, those that want to be in sobriety and those who do not. Because we have to come to some type of a, maybe it's a program. We don't know yet, right? And I say we don't know yet because I like to see from the members and hear from the members, what is it that you're wanting? Are you wanting therapy? Are you, what's going on in your situation? Matt's program, Jolyana's program, you know, they're the programs who they'd be able to share that with. Then they create these programs that could be specific to these instances. And I feel like we have to listen to those stories to really create something. But the other piece of it, you know, I also really feel that we need to learn a lot more from our other Arizona tribes who are in the northern region. Many of those tribes are very still culturally practicing their traditions. Many of the tribal leaders necessarily don't really get involved in terms of research. They're very protective of their members and being a research participant. So we have to ensure that we are respecting our IRBs and our MOUs with our tribal communities because we still haven't heard from those tribes. We can hear from our urban families that are from those particular northern tribes, but those who actually live on reservation on northern land, in our northern tribes, you know, we need to listen to them too, you know, and then be able to create a comprehensive plan in terms of what type of services we're going to start providing, not only in the urban area, but also in our tribal lands. So I would say those are my biggest lessons. I know we've not provided solutions. I think we all need to work at solutions and not only honoring our indigenous members, but also respecting them and also our tribal communities.
And I would just add that lessons learned that we took, there's just a need to communicate. So there was a lot of time that passed where people, we were becoming aware of it. This next org was, we weren't talking to each other from the beginning. And I think that that was one of our lessons learned, is that we have to strengthen our, our relationships with our tribal communities and our leaders, and maintain that. So, you know, as individuals, even past Navajo Nation, further north, you know, we were calling up to those tribal communities and try to locate, you know, we have somebody here, they want to go back. Do you have a program or a service you can offer? They just want to go home. They don't want to seek any more services. They want to go home. And, you know, if we had better communication, we'd know, oh, we'd call this person at that tribe and get the services right away. So that need for collaboration was a lesson learned. So, you know, all of us, excuse me, even when it came to here locally, finally, I think Native Health organized a meeting where we all got together and got into one room, and everybody laid out, this is what I'm experiencing, this is what I'm experiencing, here's my list, and here's who I'm going to give it to, etc. That needed to happen, I think, a lot sooner. There are some tribes that maintain the relationship with us and let us know, you know, we're here, we're set up, we're doing this, so that's helpful for those members. But we can't be tribe specific at the Indian Center. And so one of the things that we know is we have to strengthen the relationships, that partnership. And it's hard because new tribal leaders come in, so then we have to reintroduce ourselves. And we're thinking about how can we make sure we stay connected with the tribes? Well, when are their elections? So then we're going to make some introductory meetings right after so they know us and we know them. And we're a resource here if they don't have a center here. Or who are those tribes that have satellite offices, like MHA Nation, the Mandan, the Hidatsa, and the Arikara tribes? They have an office here, we learned. And so knowing that, I think, is going to be really helpful, and it's a lesson learned that we're not, you know, we're not 100% right now at it, but we're working toward, because we know that that's going to really help in maintaining an effort to support our Indigenous community.
Thank you very much for some of the lessons to be shared with the group here. So we can entertain one question before we move on to the next panel that's going to talk a little bit more about policy. Any questions? Yes, sir.
Hello. I'm sorry. I got a bunch of questions. I'm trying
Just
to.
one question.
Yeah, I
and
know.
We got to move to the next one.
I think the common theme that I've seen since we started is information education. I think if there's something that may I respectfully suggest to Jolyana, okay, is that you're with the Phoenix Indian Center, right? Okay, and you communicate with tribal nations, right? Okay, it's creating an education and information system. I suggested to Dr. Jacob Moore that the ASU College of Health, we start compiling success stories. I mean, I'm always happy. I'm a former addict, former alcoholic, right? And I became a senior officer of two major global corporations. I recovered through traditional ways, eating the right food. I mean, why can't we educate, share those success stories? That's all I'm saying.
Thank you very much. That's a wonderful suggestion. So I want to thank the panelists for sharing their knowledge and sharing their stories and lessons learned. So let's give them a hand while we transition to the next one.